Osteoporosis, as you know, is a state where people's bones are very fragile and it puts them at risk of fracturing their bones, such as their hip bones or their spinal bones, if you fall and sometimes even if you laugh or cough. So it affects a lot of people, especially after the menopause in women when the estrogen levels drop, and estrogen is the female hormone that protects people's bones. It can affect men as well, especially men who have been taking high-dose steroids for asthma or have kidney failure or other nutritional deficiencies such as celiac disease. So osteoporosis is common and the issue is fracture prevention. The trouble is it's not painful, so you may not know you've got osteoporosis. So if you're at a high risk, such as someone over the age of 70, male or female, you should be talking to your GP about osteoporosis. And if you're over the age of 70, or you've got kidney failure, or you've been using high-dose steroids for asthma, your GP will probably send you for what's called a DEXA scan, which is a very safe, 1-minute scan, very low-dose radiation, which will instantly give your GP an idea of your bone density. So you should ask your GP about that. The highest risk for osteoporosis is if you've already had a fracture though. So if you've had a minimal trauma fracture, such as falling over, and you've broken a bone either in your spine or anywhere else, you must talk to your GP about osteoporosis and have a bone density scan and see if you should be on osteoporosis treatment to prevent the next fracture. Now, a lot of people will have a bone density scan who've never had a fracture, and that'll pick up that they've got thin bones or osteoporosis, and your GP may start you on osteoporosis medications, or they might treat you with diet, exercise, and vitamin D and calcium. If they find severe osteoporosis, they may elect to send you to someone like me, an endocrinologist, for actual osteoporosis treatment, and we'd be going looking for other causes or illnesses that can thin your bones, such as an overactive thyroid and those sorts of conditions. But osteoporosis is very common because it's painless. It's something that the patient and the GP need to be proactive about. And if you've got any doubts about yourself or a family member, someone over the age of 70, talk to your GP and get them screened, because it's so easy to do the screening, and better to pick it up beforehand, before that first fracture. As an endocrinologist, I'm particularly interested in metabolic syndrome, which is a syndrome that affects a huge proportion of the population. Up to 60% of the Australian population is overweight, but metabolic syndrome implies those of us who have a tendency to put on weight around our abdomens, have a high cholesterol level, high blood pressure, a risk of diabetes, heart disease, and even cancer. But in the group that I see most of, young women and men, and middle-aged women and men, who just can't lose weight. These are people who say to me, "Doctor, I've tried everything to lose weight, I can't. I've tried every diet, I've been exercising 7 days a week, I just can't lose weight." And these are people who are very, very frustrated and don't know where to turn to. Now, very often these people have got metabolic syndrome or a condition called insulin resistance, which is a pre-diabetic state. And there's things you can do about it. So one of the things is, if you have someone who is in a sedentary job, an office professional, someone who used to be very active as a very active sports person, a netball player. I classically see it in women sent to me in their 30s and 40s who used to be high-level sportswomen. When they retire or get an injury or get married or go into an office job, they tend to do this, and they get very depressed about their weight. They can sometimes have excessive facial hair or acne, hair loss or thinning hair, sometimes irregular periods, and sometimes they present with their husbands to the fertility specialist because they can't conceive. And these women and men, if you just diagnose metabolic syndrome with a very simple tool called a tape measure their waist circumference, there's interventions that people like myself, endocrinologists, can do, both with medicine and sometimes referring for surgery, that can get them to lose a huge amount of weight and turn around their lives. We can prevent diabetes, we can prevent cancer, depression, the snoring and the tiredness we can fix, the sleep apnea. And so there's a lot of diseases we can prevent simply by taking 10 centimeters off someone's waist. A very rewarding syndrome to treat. A lot of people don't realize they've got it. They've just been struggling with their weight, watching their waistlines creep up and not doing anything about it. So the approach to metabolic syndrome should be the patient understanding they may have it, talk to their GP about it, possibly have some blood tests, and then get referral to someone like me, an endocrinologist, where we will make sure there isn't a hormonal disease, and then get in with the job of fixing it and reducing their waistline, and the rewards are enormous.